In this segment, I'm going to talk about what to expect in month number 2 and 3 after a Shouldice repair. So you've gone through the entire critical recovery after inguinal hernia surgery without mesh, and now you're ready to resume normal activity. Taking your rectus abdominis and internal oblique and stitching it to the external oblique muscle, which is what we do in 4 layers with a Shouldice repair, involves changing the architecture of your lower abdomen or your core. I think we should be treating this as a injury to the core, or like a core muscle injury. And so in those month 2 and 3, we want you to start doing some stretching. We want you to resume your normal activity, but start with a lower level of intensity and slowly work your way up. Only you know your body better than anybody else. And so it's important for you to do what you're comfortable with. If you want to, this is the time to work with a physical therapist to look for those imbalances in your core, to work on activities and exercises that are going to help you gain core strength and allow for a smoother recovery. These 2 months, month 2 and 3 after Shouldice, are really important so that the scar starts softening up, the bruising starts to go away or gone completely, the swelling is reducing, and this is your new anatomy, so we want you to be as active as you want to be. And we oftentimes encourage you to work with a trainer, strength coach, physical therapist, Pilates instructor, whoever it is that you have resources to really work on that core strengthening. I personally firmly believe that strength training and resistance training allows your muscles, your core, to get stronger. The stronger your muscles and fascial tissues are, the more they're going to distribute forces of daily living on a wider area, and I think they're going to prevent your hernia from coming back. So we lift all restrictions a month after surgery, and we really want you to do everything, and there's no weight that's too heavy as long as you work your way up to it. And oftentimes use a coach, whatever it is, whether it's a strength coach, personal trainer, or physical therapist. Like I said, Pilates instructors, there's lots of different coaches out there. But if you're committing to taking care of your body naturally, that investment is going to pay off, I think, both in hernia reduction and allow you to heal faster. By the end of 3 months, I would say 98% of our patients are pain-free, doing everything that they want to do, and have largely forgotten about us. There's only 1 or 2% of patients who still feel stiff, and that stiffness oftentimes I think can be prevented by being more physically active within reason. You don't want to overdo it and injure yourself, but we do want you to be active.